newspapers and all the medias. But let me begin with this statement that coronavirus SARS-2, which causes COVID-19, is a new virus, and it's a single-stranded RNA virus, which has an envelope. And I'll explain to you why it's important to know that this virus has an envelope. It's an RNA virus, single-stranded, with an envelope. Now, as you know, that the virus started in China, most likely from a wild animal, bat in this case, and then spread it to human being via another animal. But right now, doesn't matter, it's actually person-to-person transmission. So you give it to me, I give it to you, that kind of stuff. And that's why people are so concerned, and it's a rampage and it's a pandemic. Now, essentially, there are three routes of transmission in coronavirus. First is contact. Contact means when you touch a human being, we touch each other, shaking hands, whatever, the elbowing, whatever you do. By doing that, you are transmitting the viruses from one person to other person. Second route would be a droplet, which is the most important one, droplet. Droplet means when we cough, when we sneeze, when we talk, when we laugh, when we cry, we are producing thousands, hundreds and thousands of small saliva droplets. In some studies, they say that you produce about 3,000 droplets when you sneeze. And those droplets contain the viruses. And those droplets, when they land on somebody else's face, let's say I'm sneezing or coughing in front of you, and then my saliva droplets are landing on your nose, mouth, or eyes, then the virus can be transmitted to you. Eventually, you're going to inhale those viruses, and the virus has a destination. In this case, it's going to be the lungs. It will go inside the lungs and cause infection. So droplets is the major route how the virus gets transmitted. And then there's a questionable aerosolized or airborne. Now, airborne, if this virus is transmitted through airborne, that's pretty bad news, because airborne can be extremely contagious. Airborne means that in this case, the viruses, when you talk, when you sneeze or cough, not only droplet, the viruses can be suspended in the air up until 3 hours. So that means if I am in a grocery store and I was talking to someone, and then viruses came out of my mouth, now it's suspending into the air, and then someone else comes there 15 minutes later and then take a deep breath, there's a risk that the virus, he can inhale the viruses that I shed 15 minutes earlier. So that's called airborne transmission. But most likely, it's being overstated that it's airborne. I think mostly it is droplet and maybe contact. Now, next comes incubation period. What happens if you get the virus? What happens is the incubation period means that if you get a virus, then the virus enters in your body, and somewhere between 1 to 14 days time frame, you will get the disease or you'll get the symptoms. And that's called incubation period. It's a time that the virus takes to incubate, let's put it this way. And now, not everyone who gets the virus is gonna have the disease. So in fact, I'm gonna show later, I'm gonna talk about this later, that in fact, more than 90% will not have anything, to be honest. So we are fearful. It's nice to be, again, I think that's the right thing to do. You take all the precautions, but more than 90% times, you will get the virus and you will not have the symptoms of disease. You may have something very mild, like runny nose, stuffy nose, a little bit of fever, maybe, maybe not. So in majority of the cases, the virus will not cause any symptoms. But again, whatever develops, if you get the virus inside your body, it should be developing within 14 days. If nothing happens in 14 days, that means your body took care of the virus. Virus is most likely inactivated and killed and expelled from your body. You don't have to worry about it. Then comes something called how long, people ask me, how long an individual is infectious? Okay, that's a very good and valid question. So let's say I get the virus from Mr. A. Now, and I have the disease now, okay? Now, I would be infectious to Mr. B 1 to 3 days before my symptoms develop and up to 7 days after my symptoms develop. Is it clear? So what I'm saying is, so I have the virus and the virus entered in my body. And then now I have the disease. So I transmit the virus to others even before I develop symptoms. And that's a dangerous period. So you may carry the virus, you may have the virus, but you don't know because you don't have the disease yet. So 1 to 2 days prior symptoms, and after 7 days of symptoms, up to that period, this 10 days, overall 10 days, you can spread the virus. Okay, so that's one of the problems. Now, people ask that if I go to a grocery store and somebody sneezed there, do I get the disease? Do I get the virus? Question is, it depends on multiple factors. Yes, coronavirus is a contagious virus, extremely contagious, but it doesn't mean that you will get the virus if you're in contact with somebody with the disease. It depends on a few factors. Factor one is number of virus particles that you are ingesting or you're inhaling. So what does it mean? It means this. So let's say, for discussion's sake, that every time you sneeze, 3,000 virus comes out, okay? Every time you talk, 900 virus comes out, okay? Every time you cough, 1,500 virus comes out. Let's say, for discussion's sake. That means when you talk, it's only 900. When you sneeze, it's 3,000. So that's called viral load, actually. So if you get on somebody's face and that person sneezes on your face and the droplets goes right inside your throat and your lungs, you're getting 3,000 virus, huge viral load. Versus if somebody's talking and chatting with someone and then they left, half an hour later you went there, maybe from their mouth, 1,000 virus were out, but within 30 minutes, the virus was shedding, they're dropping onto the floor, and eventually there are maybe 25 virus suspended in the air. And you're breathing that air, you're only getting 25 viruses. So by taking 25 viruses, chances of getting infected is extremely slim. Makes sense? Second is your immune status. If you are a healthy individual with a strong immunity, you don't have any other major sickness, then your body will be able to handle the virus that you're inhaling and body can take care of it. So not everyone will have the disease after inhaling or ingesting or taking inside the viruses. Make sense? Third is the route of transmission. That means which route the virus is entering in your body. I'm gonna clarify it. Let's say I touch someone and they have the virus. Now I have the virus in my hands. And then I rub my eyes later and the virus enters into my eyes, eventually through the nasolacrimal duct, goes into my mouth, and then I inhale the virus into my lungs. This is a route. Versus I'm talking to someone who has the disease and you sneeze on me, I'm just 12 inches away apart from you, you sneeze on my face and I got some saliva all over my face. Now the viral load will be much higher in this case. So the chances of getting an infection from someone sneezing and coughing on your face is much higher than you touch a surface, you handle money, you're receiving a parcel from UPS, and then eventually you touch your eyes or rub your nose or touch your lips, and the chances of getting the infection is much lower. Make sense? Okay. So the bottom line is this, and that's what I want to emphasize on, because people are so obsessed with the virus transmission that people are so scared. I would say, no matter what, the only way, there are two ways that virus can enter inside your body. Okay. Number one is if somebody coughs, sneezes on my face, or talks on, speaks in front of me, and he doesn't have any mask, I don't have any mask, and then I get the saliva droplets and I get the infection. Second is I touch something and I pick up the virus in my hands, and then I rub my eyes, nose, or lips, or touch my eyes, nose, and lips, and the virus gets inside. So essentially, you will not get the virus, no matter where the virus is, how much virus is there, as long as you don't touch your nose, eyes, and lips before washing, right? So if I handle, let's say I received a package from UPS and I had virus in my hands, 2,000 viruses in my fingers. But then before touching my eyes and nose, I rinse my hand with soap and water for 20 seconds. That's the recommendation. Then I will not get the virus. Make sense? So just remember that there are two major routes. One is yourself, your own hand touching your face, and other is somebody is coughing on your face. Okay. Now, so let's say the virus, I got the virus. Now the question is, what's going to happen to me, right? So there are three things can happen to me. One, I said the majority of the cases, nothing is going to happen to me. I'll be absolutely fine. The virus will be taken care or handled by my body's immune system, and it will be kicked out of my body, and I'll be fine in a few days. There's a slim chance, we'll go with the numbers, what percent, there's a slim chance that I will get the virus and I'll get aches and pains and fevers, runny nose, stuffy nose, minor problem, and then I'll get better in a week or so. And there is even slimmer chance that I will be so sick, I'll have fever, I'll have cough, I'll have difficulty in breathing, I'll have lack of oxygen in my body, and then I'll end up in a hospital. These are the possibilities. So again, in a nutshell, what are the symptoms of COVID-19? The symptoms of COVID-19 is runny nose, stuffy nose. Usually it starts with body ache, headache, throat pain. Then you can have fever, low-grade fever. Then eventually the fever goes higher. You'll have chills and high fever. You'll have shortness of breath, chest tightness, and a dry cough. Now, we are also seeing that people may have pink eyes, conjunctivitis. People may get, again, nothing to be that scared of, but these are the facts and realities, that people may get stroke. People may get inflamed toes and fingers. They may have something called stasis of blood. That means your blood gets clotted inside your blood vessels. You can have a variety of problems. But in general, the rule of thumb is fever, runny nose, stuffy nose, cough, maybe pink eyes, difficulty in breathing, chest pain, shortness of breath, kind of stuff. Now comes the main topic, main discussion, that how dangerous is this virus? This is definitely extremely contagious. That means the transmission from person to person is very fast and rapid. And no wonder, that's why the 184 countries are involved, millions and billions of people are affected. So this is extremely contagious. But how dangerous is this? Now, I'm going to give you some numbers. First of all, let me see so first of all, this is dangerous for people who are elderly. We know that already, that people who are above 80 years of age. This is dangerous for people with comorbidities. That means people who have heart problem, diabetes, hypertension, chronic smokers, other diseases. This is dangerous to people who are obese, because when you're obese, your lung function goes down. So your lung doesn't get enough air. It gets stagnant, and the virus can multiply, replicate faster. This is dangerous for people who has, as I said, who are in a nursing home kind of setup. But for a healthy, otherwise healthy individual, this may not be that dangerous. But again, I'm gonna give you some numbers. Up until now, we did not have a solid numbers because we didn't have enough tests done on people. So we didn't know who are positive, who are not positives. There's a study done, I think the result was out 2 days ago, and the study involved people in New York State, and they studied on 7,500 people and did some antibody testing. I'm not going to get into detail with antibody testing. That will take time. That's a separate lecture. I'm not going to go there. So antibody testing was performed, and they found out of 7,500 people in New York City, 25% of those 7,500 people were positive for this virus. In Long Island, it's about 14%. In upstate New York, it's about 3%. What does it tell you? That it tells you that irrespective of how safe we, what we are saying is, even with all the measures, social distancing, lockdown situation, despite all these measures, 25% of New York City population got the virus. 25% of New York City population is 8 million. 25% of 8 million is 2 million. So 2 million people, 1 out of every 4. Right now, if there is 20 people watching this video, 5 of us will have the virus, but we don't have the symptoms. So that's a different story. So 25% of New York City population have the virus, this study showed. Now, what are the number of deaths? The number of deaths in New York City is 12,000 up until yesterday, 12,000. So 8 million people, 2 million got the virus, 12,000 died. So now you can find the case fatality rate, that how many people dies from the virus. In fact, case fatality rate is 0.6%. I want you to understand. So 0.6% means there are less than 1 person who has the virus will eventually succumb, will die. Less than 1%. And the hospitalization rate is less than 10%. I'm gonna get into that in a couple of seconds. So what does it mean? It means that this virus is extremely contagious. Most likely you'll get it. But the chances of you having a disease from this virus is extremely slim. And the chances of being hospitalized is even slimmer. And the chances of, God forbid, dying is extremely low. If you're healthy, you don't have any comorbidities, and you are in good shape. Okay. Treatment. How do you treat this virus? You cannot treat this virus. There is no treatment yet. We're going to talk about some medications that people are talking about, and they're doing some studies in Europe, in Southeast Asia, in Japan, and in the United States of America. But right now, the treatment would be symptomatic treatment. That means if you have fever, take Tylenol. Go for rest. You rest. Drink a lot of water and try to stay healthy. And also, there are a few other recommendations. One is social distancing. You try to keep 6 feet, not in front of you, at the sides, in the back, everywhere 6 feet, a spare of 6 feet from another person. So that person sneezes or cough, you don't get the virus. Okay, that's to prevent. Then you wear a mask. Okay. If you're sick, you self-isolate yourself. If you're in contact with a sick person, known sick person, you quarantine yourself. Maintain a good hygiene. The most important is you increase your immunity. You make sure that you have the power to fight the virus. That's important. How do you increase your immunity? There are a few things. You have to have good nutrition. Eat good, eat healthy, plenty of vegetables, fruits. Drink a lot of water. Keep yourself hydrated. Get rest, at least 7 to 8 hours of sleep every day. Do some mild, light exercise. And consider vitamins. People talk about vitamin C, vitamin D, vitamin E. Some people talk about zinc. Do all these. And then most important is be happy. Be happy and think positive. You will be able to handle this virus. Now, there are some breathing exercise that has been, some people are talking about. Since the virus actually goes inside your lungs and causes the disease, that pneumonia, you can make your lungs a little stronger by doing some breathing exercise on a daily basis. There are a few exercises that I can talk about. One is you inhale air, you breathe in for a little longer period of time, slow breathe, 3 to 4 seconds. So 1, 2, 3, 4, 4 seconds. And then breathe out. But remember, you breathe in and breathe out through the nose, not through the mouth. Keep your mouth closed, breathe through your nose. So I'm going to show it to you now. By doing this, you're ventilating your lungs, you're oxygenating your lungs, and you're making your lungs stronger. The second exercise, which we call it 2-to-1 breathing. 2-to-1 breathing means you inhale and then exhale double the length. Okay, let me make it clear. So you inhale for 3 seconds, and then when you exhale, make it 6 seconds. So I'm inhaling for 3 seconds, and when I'm exhaling longer, 6 seconds, double the time. This 2-to-1 breathing does a different thing, very interesting. It actually takes your anxiety away. A lot of people, when you are home quarantined, you cannot go out, the whole world stops, nothing is happening anywhere. You can go to a mall, you can go to a movie theater, you can socialize, you're frustrated. So sometimes you can have anxiety attack or panic attack. This 2-to-1 breathing decreases your anxiety and panic attacks. You can do that. And there are a variety of exercises. You can go to internet and figure it out. Okay. So the third thing is controversial, but I decided that I'm going to talk about it, is how to increase nitric oxide in your lungs. Nitric oxide is a chemical that's produced in your sinuses, and that nitric oxide actually increases your blood flow to the lungs, and also it's an antiviral, antibacterial, and antifungus. Now, how would you increase nitric oxide in your area? That's called humming. When you hum, you increase your nitric oxide. And I'm going to show you what you should do. You should take a deep breath, inhale, and then when you breathe out, instead of breathing out through your nose, you hum. So you do this. You make the humming noise. When you hum, you vibrate your sinuses. Your sinuses gets vibrated. When sinuses get vibrated, you release nitric oxide. It has been shown in a study in Sweden that when you vibrate your sinuses, the nitric oxide concentration in your airway goes up 15 times. And that nitric oxide is good as an antiviral, antibacterial, antifungal. Yogis have been doing this in India for hundreds and thousands of years. I don't need to do it because I hum. I sing all the time in the bathroom. So since I sing in the bathroom, I don't have to hum. But you can hum, and that will also help. The third is the treatments, future treatments. Now, there have been few drugs that people are looking at. Everybody knows about hydroxychloroquine. Now they're talking about Pepcid, famotidine, and then definitely some antiviral therapy people are working on, remdesivir, ritonavir, Avigan, which is I think favipiravir. These drugs are not specific for coronavirus. I want you to understand this. Like remdesivir was actually made for Ebola. And some studies show that it works. If it works, it works. That's fine, no problem. But you're not going to take it on your own. You're going to take it, or you'll be given it in a hospital setting, God forbid, if you get hospitalized. Otherwise, you're not going to see those drugs. Convalescent plasma therapy is another therapy. And people are talking about vaccines. And you know that it's been, people are working on vaccines. But normally a vaccine takes 8 to 10 years. So now they're trying to cut it short, 1 to 1.5 years. Hopefully by the beginning of next year, we'll see vaccines. So in a nutshell, God forbid, if somebody gets to the hospital, what happens? If somebody gets to the hospital because their oxygen is low and they're coughing, they have persistent fever, then in the hospital, they'll get intravenous hydration. They'll get intravenous antibiotics. Worst comes to worst, they'll be kept in a machine, ventilator. And then, God forbid, for a few people who are extremely sick, you may do something called ECMO. Again, I don't have time to discuss all this treatment. If need be, we can have a later discussions. Now, at the end of the discussion now, question is, what should we do given the pandemic? We are in an era, or we're in a time where the pandemic is on. I would say first, take it easy. That's wisdom number one. Second, think positive. Don't think negative. Think that there is light at the end of the tunnel. It's not total darkness. Third, take a walk. Take a walk outside every day. Soak some sunlight. Sunlight has ultraviolet ray, and ultraviolet ray kills the viruses. No, we know that. So take a stroll. Soak some sunlight. Fourth, take a deep breath. When you're outside, fresh air, oxygen, God's given. Go ahead, take a deep breath with oxygen. 5, drink a lot of water. Drink a lot of water. 6, exercise your body, exercise your lungs. and lost one, be happy. That's it. Thank you, guys. I'm open for questions.
Thank you very much, Dr. Nafis Khan. Thank you. That was very informative. Okay, so right now we're going to be taking questions right now from everyone. If anybody has any, they can unmute and then start asking the questions. Hello, 1, 2, 3.
Assalamu alaikum, Nafis bhai.
Walaikum assalam.
বড়দের সিমটম আর ছোটদের সিমটম কি আলাদা? ওই যে বাচ্চাদের টোতে যে র্যাশ দেখা যায়, এটা কি এই সম্বন্ধে কিছু বলবেন?
আচ্ছা, সেটা হচ্ছে যে বড়দের আর ছোটদের সিমটমস আলাদা নয়। আমরা প্রচুর বাচ্চা পাই ইমার্জেন্সি রুমে যাদের কোভিড আছে, এবং তাদের সিমটমও বেসিক্যালি জ্বর, সর্দি, কাশি। আমি কোভিড টো এখনো দেখিনি। আপনি যেটা বলছেন সেটা হচ্ছে কোভিড টো। কোভিড টোটা ওই যে বললাম, আগেই বলেছিলাম যে এখন দেখা যাচ্ছে যে ভাইরাসটা রক্তকে ক্লট করে দেয়, জমাট করে দেয়, এবং যেহেতু রক্ত জমাট করে দেয় সেহেতু হয়তো ব্লাড সার্কুলেশন টু দ্য টোজ গেটস কম্প্রোমাইজড, এবং তখন টোটা মানে আঙুল, পায়ের আঙুল, হাতের আঙুল অনেক সময় একটু লাল হয়ে যায়, ফুলে যায়, সেটাকে কোভিড টো বলে। আমরা সাধারণত আমি পার্সোনালি কোভিড টোর পেশেন্ট দেখিনি, কিন্তু আমি জানি যে এই পেশেন্টগুলো ইমার্জেন্সি রুমে এলে আমরা ডার্মাটোলজিস্টের কাছে পাঠাই এবং তারাই বেসিক্যালি চিকিৎসাটা করে। কোভিডের যেটা মেইন প্রবলেম সেটা হচ্ছে শ্বাসকষ্ট এবং low oxygen. That's something that we worry about.
Thank you.
You're welcome. Okay, go ahead. Yeah. Okay. Mr. Hassan had a question that is it safe to do antibody test? Absolutely safe to do antibody test. Antibody test is called serologic test. We do it every day on other viruses. So all you need to do is go to a physician. A physician will draw some blood and then we'll send it to the lab, and the lab will check for antibodies and we'll let you know next day or day after whether you have the antibodies. So it's safe. And do it before, safe to do it before we get back to work. That depends on the planning of the government and the local health department. Right now the plan is to do as many tests as possible. And I'm a big believer that we should perform this test to every human being in order to find out who is positive, who is not. Because if you're positive, then you have the antibody, so you can go out and work in any setting. You can be NYPD, you can be a doctor, you can be a retail seller, salesperson, barber, it doesn't matter. So I am a big promoter of doing the test. So yes, before going back to work, you can go ahead and do the test. Your second question was, does plasma therapy help everyone? Not necessarily. It's a trial and error. It worked in the past. We know that we use plasma therapy for a variety of diseases in the past. So this is not something very new. So it's worth the trial. Yes.
So I'm on mute now. So Nafis bhai, this is Wasim. I'd like to ask you one question that, as you mentioned that whoever get the positive and recover themselves, they can go and work, they can perform their daily life. Is there any possibility that they could get infected second time? If they even get the infection, what is the worst condition? I don't want to mention the fatality rate about that. I don't know the outcome of that, the second time infection, but can you give us a little brief, like
I get the question. I get the question. Yes, I get the question. First of all, the history answers some part of your question. The history is Spanish flu came in 3 waves. First wave, second wave, third wave, 1918, 1919, 1920. So that's why people are saying that this may come back again. That's one. Second is, your question is, if you have the antibody, can you get the disease? Usually you should not get the disease, but it's not applicable for all viruses. Remember, this coronavirus is a new virus, so I can't tell you right now with 100% certainty that you're not gonna get the disease if you have the antibody. Because what if the antibody wears off in 6 months and then you are back to square one, and then you are exposed to the virus again and you'll get the disease. So that needs time. So we will know by next year whether we have a permanent immunity like other diseases, like chickenpox, measles, after you get the first immunity. So that yet to decide. I can't give the answer right now. Now, your third question was that what happens if you get the disease again? Can it be worse? Well, common sense wise, it should not be worse because you have some immunity from the first time. So your immune system knows how to handle this virus. So I think that gives you some protection. But again, yet to see. It's a new virus, Wasim Sheb, so we can't make the decision yet.
Thank you, Nafis bhai. I have another follow-up question regarding that. As many states and most of the states actually right now thinking about withdrawing the social distancing and social isolation, opening up their business. So what is your suggestion to us? Like when it will be normal, or I'm worried about the kids mostly when the school will open. What is the first precaution we should take?
First of all, follow the rules. The rules are you have the safe distancing is one, wear a mask, and try to wash your hands every time. If you touch your face and eyes 100 times a day, wash your hands 100 times a day before touching your eyes, face, and lips. That's my recommendation. Second is, I do believe in opening up society because the earth that we live in, the world that we live in, was built for over thousands of years, this civilization. We can't let this civilization go down the drain. So we have to save it. And the one ways of saving it is going back to your regular lifestyle with some precautions. So we don't die from inflation, we don't die from famine, we don't die from suicide, we don't get psychological disorders. So this needs to be addressed in the proper way. So I think we should be careful, but slowly but surely we should open up things.
Thank you.
You're welcome. Next question, from Talal. Should healthcare workers fast right now? Does fasting affect immunity in any way? Well, I don't know whether healthcare workers should fast or not. That's the people's belief and their religious belief. Can fasting affect immunity? I don't think so, because you can readjust your food intake, nutrition intake, and water intake in a different time. So even you're fasting for the day, but rest of after evening, you are allowed to drink and eat whatever you want. So you can drink a little more after iftar and before going to bed. And you can take the liquid amount that you need to, during that time. So I don't think there is a problem. Okay. Okay. Anybody else?
That's right. This is Ron. A quick question.
Yeah.
Are you expecting to have a second wave of this COVID-19 once, assuming that we'll go back to somewhat normal? Are you expecting another wave?
Well, historically, the virus is like earthquakes that comes in waves. So historically, the virus comes for the second and third wave until you get the vaccination and you know the virus so well that you are not concerned anymore. So I'm expecting a second wave, but I think, in my opinion, second wave will be much milder than the first one for 2 or 3 reasons. Number one, people are aware. Number two, we will start testing every single individual in September and October when they come to the hospital or go to their doctors with runny nose, stuffy nose. Right away, you get the test will be done and you quarantine or isolate the person, needs to be isolated. 3, by beginning of next year, we're expecting a vaccine. If that happens, we're pretty much done. Plus 4, there's something called herd immunity. I don't have time today to discuss this. Again, if you guys want, I can have a second session later. That herd immunity is immunity that you get as a society. And that immunity will be attained, hopefully, before the next wave. So I think there will be a second wave, but it's not going to be as bad as the first wave.
We have one question from Abu Yusuf. Why is the vaccine taking so long to be ready?
Very good question.
You pay your
I'm
taxes.
pretty sure that I mentioned that actually on a regular time, a vaccine takes 10 years to develop for many reasons. First of all, you have to know the genetic code of the virus, which we know already. Chinese helped us with that. They gave us the code. Second, then when you prepare the vaccine, you go through multiple trials, phase 1, phase 2, phase 3 trials, because not only you want to take care of the disease, but you have to make sure that the treatment is not worse than the disease. যদি চিকিৎসা রোগের থেকে খারাপ হয়ে যায় তাহলে তো মুশকিল। এখন ভাইরাসের যদি ভ্যাকসিনের যদি সাইড ইফেক্ট, if there is major side effects of the vaccines happens, then that would be a problem. So the pharmaceutical industries who produce the vaccines, investing billions of dollars, wants to make sure that it's safe for the community and for the people. So that's why vaccine takes time. The earliest time that a vaccine can be produced, I would say somewhere between 12 months to 18 months, not before that, impossible.
We have another question from Hassan again. Why are ventilators being used despite being ineffective most of the time?
Very good question. It's $1 million question. One of my friends actually, who is taking care of a lot of COVID patients in ICU setting, told me exactly what Mr. Hassan just said or wanted to know, that these ventilators are a lot of times are not working because, again, that's the discussion that, see, there is something called cytokine storm. We don't know that the difficulty in breathing in these patients are whether from a cytokine storm or it is from microvascular coagulation. That means that small blood vessels in the lungs are clogged with small thrombus. And when they're clogged, there's no blood circulation to the lungs. So whether you're putting a ventilator and inflating the lungs, okay, it doesn't matter because there is no blood supply to the lungs. When there's no blood supply to the lungs, then the lungs can provide oxygen to the blood, right? So since it's a mystery, and that's why we don't know, but you know what? The bottom line is this. Your job is to do everything that you can. That's why people are keeping patients on ventilators, because if you, without ventilator, their oxygen will go down to 80%. We can't let that happen. So in order to increase the oxygen, we have to try every means within our capacity, and that's what we are doing. Thank you, Mr. Hassan, for this very good question.
Anybody else? We have some more time to take more questions.
Well, I'm here.
So you're saying we should not use Lysol, right?
No.
I'm just kidding.
So Lysol, remember I said at the beginning of the discussion, this virus has a envelope. The envelope is made of fat, lipids. So the viruses, those have envelope, can easily be killed with alcohol, ultraviolet light, humidity, and disinfectant. That's the rule of thumb. Now the question is, you can only kill those viruses when they are on a surface, on your table, on the chair, on your shirt, on your in the steering wheel in your car, or maybe on your surface, on your body, in your hands. That's why you can kill those viruses with those. But once the virus gets inside your lungs, none of these work because the virus is hiding inside a cell. So without killing that lung cell, human cell, you cannot kill the virus. That's the problem. So that's why you just can't pull the lungs out and rinse it with Lysol and all these. It doesn't happen that way. So that's a misunderstanding. I don't think the president meant it. I think, you know, I'm not defending the president. I don't think he meant it, but there's a miscommunication. Thank you, Rana, for the question.
One follow-up question. I have heard that, read it online, that when summer comes, because of the heat wave and during the summertime, there will be a reduction of this virus spreading. Is that true somewhat, or it's just a hoax?
This is true. I actually had a videotape on YouTube a month ago, and then I said that I'm a strong believer of that because I feel during the summer months, few things happen. Number one, there's ultraviolet light because the sun stays longer. Sun rises at 6 o'clock, sets at 8:30 p.m. So almost 14 and a half hours of sunlight. That sunlight has ultraviolet light, and ultraviolet light kills the virus. We know that. It kills the envelope of the virus. So the virus gets killed. Number one. Number two, during the summer, humidity is higher. When there is too much humidity, then what happens when you have the virus in your saliva and you cough, the saliva comes out. Now, because of humidity, the saliva doesn't dry up. So it stays with the virus, makes the virus heavy. So the virus falls on the street or floor, whatever, on the ground. But during the winter months, when you cough, the droplets comes out, it dries up. When it dries up, saliva is dried up. Now only you have the virus, which has no weight. So virus suspends, flies in the air, and it stays longer. So that's the difference. So yes, going back to your question, the summer months, not only heat wave, it's the sunlight and the humidity will kill the virus. There's a study done a few days ago, which showed that in the presence of ultraviolet light and humidity, the virus gets killed within a minute, 90 seconds versus 18 hours. That means if you don't have ultraviolet light, not summer, no humidity, then the virus can last up to 18 hours on the surface, but last less than 1 minute in the presence of ultraviolet light and humidity. I hope I answered your question. Anybody else? Any other questions?
I think we had one more person come. Wasim,
Okay, go ahead.
I already asked my question, Shami.
Oh, okay. You unmuted yourself for a moment, so I thought you were going to ask a question, but that's okay. Anybody else? A few more seconds, yes. If anybody wants to ask questions in Bengali, please feel free.
Oh, please feel free. বলেন বাংলা প্রশ্ন করা যেতে পারে, কোনো প্রবলেম নেই। Looks like no other questions.
I guess so.
Okay, so
yeah,
go ahead.
But that's okay. Let's conclude the meeting right now. So we'll end the questions for now. If anybody else has any more questions, they can also contact us through our email. It's learnfromramadan@gmail.com. So
I don't have any question, but Shami, I have one request that can you share this recording so I can share with my family, whoever in Bangladesh and elsewhere. So if you have this recording, this is a very informative session. So I want to circulate in my family and relatives.
Yeah, of course. I was gonna ask Dr. Nafis Khan about that, and of course there will be a recording as long as he gives me permission to post it.
Yeah, I have no problem. That's fine.
Okay, perfect. So yes, the video will be edited and everything will be uploaded within a couple of hours, and then I'll give it to the people, whoever wants the link to it. Thank you so much for joining us, Dr. Khan. That was very informative, and we had some very good questions.
I'll just make one last statement.
Sure.
We are in a difficult time, and that's for sure. And this is the time that people will lose it. Some people will get extremely frustrated. Some people will get extremely sad. Some people will get angry. But the reality is, this is not the first time that this happened to our civilization. Spanish flu happened. We had plague. We have smallpox. I was reading about smallpox, which had 30% mortality rate. 30% people used to die from smallpox, and we got rid of it. We got rid of them all. So there is light at the end of the tunnel. And this is the time you take it easy and fight back. That's it. Fight back against this virus. Thank you, guys. Thank you very much.
Thank you, everyone. Thank you for joining us, and hopefully we'll see Dr. Khan again soon. All right. Thank you, and assalamu alaikum.
Walaikum assalam.